What is the following is the most likely diagnosis? A 40-year-old woman presents to the psychiatrist with a 6-month history of believing that her neighbor is secretly in love with her. She claims that they have never spoken, but she is convinced that the neighbor is sending her subtle signals of affection. She has no other symptoms and her daily function remains intact. Okay, I would call this just delusional disorder. Now, believing something to be true when it's not. It would be honestly to me, they'd say nothing. So I can ask you this right, just for now. When they see the words with psychotic features, that means that those psychotic features only happen in the presence of bipolar disorder, or is it like 2 weeks? I know there's like something I always get confused, and so
Yeah, there's specific guidelines for sure. To me, I can't remember like the specific time range and things like that. But the way I think of it is like when they say with psychotic features, right? So like psychosis. So describe to me what psychosis is.
so I would say just symptoms of like schizophrenia, so like flat affect, hallucinations, auditory, visual hallucinations,
Yeah. So some
things like that.
hallucinations and things like when you get in psychosis, like, you're really talking about like schizophrenia, like an acute attack of schizophrenia, right? So when you're talking about mood disorders with psychotic features, then you can have some hallucinations, things like that. But just remember the main thing is that, you always start with the main thing, right? Which is either when they say bipolar. So she has to have symptoms of bipolar with maybe some hallucinations, or you have everything with depression with some hallucinations, right?
Mhm.
So the weeks and stuff, I always forget. That's a little bit more clinical. They usually don't ask like on a week standpoint on that, but just understand that when they do mention like a main disease process with psychotic features or the reverse, right? Like schizophrenia with mood disorder, right? So like
Mm,
you have mainly schizophrenia, but with sometimes you get depression. You know what I'm trying to say? So that's how I
yeah.
always remember. So you don't have to go too deep in the weeds and get, really tangled into it. So
Okay. Well, with that, I would still go with a delusional disorder.
yeah, delusional disorder definitely fits here, right? And so there is some delusion in, schizophrenia, right? But if you don't have the rest of the stuff like flat affect, things like that, then it's going to fit mainly with delusion disorder.
Hmm.